men of the press. We want to speak to you about the recent developments in our fight against COVID-19 in Abia State. You are aware that it was on the 27th day of February 2020 that this virus, COVID-19, made its way into our country from Italy. And as soon as that happened, the federal government responded by setting up a presidential task force on COVID-19, which quickly identified the hotbeds of this pandemic in our country, looking at the major entry points into our country, namely Abuja and Lagos. Though we remain in prayer in Abia that somehow this virus will elude us, we also went ahead to prepare, like many other states, in case of a rainy day. In our efforts to make sure that we remain safe in Abia, this government have provided 2 isolation centers in Aba and Umuahia with a combined capacity of about 50 patients. We are also happy to acknowledge that our tertiary institution, the FMC, also have an additional facility for isolation. We have, in collaboration with NCDC, trained all our frontline officers in preparation for any eventuality. Our government has provided 6 ambulances to support the logistics around testing and picking up of patients from the hinterlands. We have also procured some ventilators, oxygen concentrators, patient monitors, and indeed, as I speak, we have more than enough PPE to support our frontline officers in their effort to keep our state safe. Additional measures which this government embarked upon include banning of public gatherings, marriages and meetings, which culminated in the total lockdown of our borders and indeed our states, which commenced about 14 days ago. Unfortunately, yesterday, the 20th day of April 2020, we recorded 2 index cases that has tested positive for COVID-19. The significance of the index case in Abia is multiple-fold. The first implication is that at least it is now clear to everybody that COVID-19 is real. The second one is that a close study of patients indicates that they are septugenarians. One is 70, the other one is 72 years old. Incidentally, they have no previous history of travel, at least in the recent past. What it means is that this pretty much looks like a case of community transmission, unless the study we are currently undertaking proves otherwise. It has placed on us the additional burden to make sure that we recall every protocol and directive that the government has initiated, dovetailing from what NCDC is directed to us as a way of keeping ourselves safe from COVID-19. You will recall that we have insisted that we wash our hands regularly using soap. We also said that if you cannot wash your hand all the time, ensure you avail yourself of a good sanitizer with which you clean your hands. We have also recommended that we maintain at least 1.5 meters distance from each other and avoid crowded places at all times. It is because of this that as I speak today, we have started our radio classroom where our children, our pupils, our students are studying through interventions on radio and online while at home. In direct response to the index cases that has emerged, this morning we have dispatched our officers on a rigorous contact tracing exercise. We must therefore thank and encourage our frontline officers who have put their lives at risk for the sake of all of us. They have previously followed and tracked all cases that were reported. You recall the notorious case of Miracle, who was tracked and tested. Incidentally, the results came out negative. 24 hours ago, we were also able to track and apprehend one Prosper, and the results have returned negative also. So what is the way forward for us? The days ahead in Abia, on account of these two index cases, will be difficult, and it calls for more courage and commitment, not only in the hands of our frontline officers, but indeed all citizens. Government will provide personal protective equipment required to protect our medical and paramedical personnel that are on the front line of this battle. We are going to send immediately a consignment of additional PPE and equipment, including oxygen concentrator and patient monitor, to FMC to support their efforts in managing the test cases at hand. Government will insist that all our borders shall remain locked till further notice. And may I seize this opportunity to urge our law enforcement agencies to redouble their efforts to support our local youth and vigilante on the border patrol. This is no longer a time for anybody to compromise for whatever reason. COVID-19 is real and it is here with us. This government will treat any individual or citizen that undermines our effort to keep the rest of us safe as a saboteur. And such a person is meant to face the full weight of the law. All our citizens should remember that wearing of masks in Abia State has become compulsory. And with the establishment of mobile courts in Abia and Umuahia and elsewhere, we will ensure that we will arrest and prosecute any defaulters. We have noticed that some individuals come with the face mask in their pocket only to make a show of it when they see an approaching officer. We will ensure that such a person is apprehended and arrested, because we are not only putting your life at risk. We don't mind if you exercise that code, but we plead with you to please, for the sake of others, make sure you wear your face mask if you are outside your room in Abia State. Government will encourage all citizens to continue to practice social distancing and imbibe the strict rules of personal hygiene, namely hand washing, as well as the use of sanitizers. We shall continue the massive contact tracing across all the local governments where these index cases have been associated with in the past. Hence, our track will cover Ikwuano, Ukwa West, as well as Umuahia North. These are the initial local governments that have contacts with the index cases, and we need to quickly wrap up all the data we can and look at every individual that has something to do in the recent past with the index cases. The private clinic where this patient, one of the patients was treated, is hereby closed to public until properly disinfected, while all the doctors and nurses who attended to them shall remain quarantined until the results of their tests return. The state shall embark going forward on a massive community testing, drawing samples from ward to ward, even in local governments that are remote to the target local governments as described above. It is important to note that both patients had underlying medical conditions ranging from diabetes, high blood pressure, stroke, and heart failure. However, we are optimistic that our medical team and the team at FMC are capable of doing a good job, God helping them. Finally, in Abia, let's take heed. Please remain at home. Thank you. We have made sure that all the tools that the police require to do their work and support the Homeland Security as well as local vigilante has been provided. It is an ongoing process, and there is no relationship between compromise and PPE. An officer that wants to compromise, whether he has PPE or not, to compromise. But I want to seize this opportunity to call on officers are Nigerians in the first place before you become an officer. This is a national assignment, it is a duty. It is something that is capable of claiming the life of old, young, their loved ones, including those you hold there and seek to protect. Therefore, I want to seize this opportunity once again to appeal to every person that has a role to play. From the frontline officers, the medical doctors, this assignment is beyond what money can buy. It is beyond a motivation that money can provide. The motivation to do this job should come from our belly. It's something that should come naturally, that it is our responsibility to first protect ourselves and protect those that are under our care. Therefore, I want to ask that we redouble our efforts and show greater commitment. I have received complaints of people who compromise their positions and allow individuals to move about. I've even received complaints about traders who open their shops in the night and early hours of the morning, encouraging travelers and sojourners from other states to come into Abia State. This will be regarded as very, very serious sabotage. Waging war against this pandemic is like any other war. And anybody who allows himself to be used, either because of his selfish ambition or because of his carelessness, to undermine our effort to keep COVID away, will be treated as a saboteur, and the laws are available to make sure that the person is brought to book. So please, let all of us redouble and dedicate ourselves to ensure that we do the needful, manning whatever duty posts that have been assigned to us, to ensure that all of us together we see each other at the other side of Jordan. because this is real. Contact tracing for the 2 cases we have at hand may lead to anything beyond what you can imagine. So this is no time to joke. This is the time for us to be very, very serious. If it runs out of our control and our hands, I'm sorry, the circumstances will be there for each and every one of us. And at that time, we begin to regret our actions and inactions. So please, we should take it. To mention the names of our patients, I think the law does not give me that, whatever. But then, I had mentioned Prosper and Miracle because they are notorious. They went on Facebook and they were talking about it, but it's our duty and responsibility to protect our patients. Like I said before, we are doing everything to make sure that COVID-19 patients are not stigmatized. It's like the virus that causes trouble in this COVID-19 is in the same family with the one that gives us common cold. So you cannot stigmatize somebody who has common cold. You know, it is not as bad as HIV/AIDS that is associated with immorality. Anybody can go down with COVID-19. So I don't want us to stigmatize COVID-19 patients, but truth be told, we have to be careful because it's highly, highly contagious. Then back to the issue. We have said it time and time again. This government will not support extrajudicial killing. But I want to say this, and we know the truth. I recall the particular incident that happened in Aba. Law enforcement officers accosted a gege operator that had defied our order to stay at home. And when they arrested him, they put him not in a cell but behind the counter. And those who plan to loot, because we have people in the society that come out every day with an agenda to break shops and loot. They started with a wrong signal that, the keke man has been shot, he is dead. Can you imagine? This will not happen. And they now went to attack policemen. Any citizen that knows he wants to protect his right should not attempt to collect a gun from an officer. No policeman will allow you to take his gun from him and trap him. So if you see somebody that is armed, in as much as we will stand with the citizens to ensure that no officer kills an innocent citizen, we want to say to our citizens, don't attempt to collect the rifle of a police officer. It's a very dangerous game. And anybody who embarks on that kind of courage, the consequences can be very, very there. So we want to seize this opportunity to say that we will bring every officer that is involved in extrajudicial killing to book. And the person will face the full weight of the law, because you are not supposed to use the rifle which you are supposed to protect us to kill us. What we are saying also is that our citizens should be careful, we should be discerning, we should be mindful. The pieces of information we get on social media and the ones that are carried on the streets, we should be able to discern the truth and know what to do at any time, and not join the crowd to do what is not good. Speak for what we know in Abia State. We have prepared special allowances, and that should be able to take care of their risk. And if they operate according to the protocols and the rules, using the PPEs and doing what they need to do as professionals, abiding by the training they have received, we know that 99% of our frontline officers will survive. We have not done anything about insurance as I speak. It could be a good idea, but they are going to get handsome allowances for the risks they take on our behalf. There is a protocol for shutting down a clinic, and even as we have announced that today, we are following up with ensuring that first of all, test the patients that are already there, and then begin gradual shutdown of that clinic. Mentioning the name here, at this point will be a little bit premature, but we'll get to know in less than. We have reported to every office that needs to know. The Federal Ministry of Health is aware, NCDC is aware, and because of the circumstance of our case, this lockdown is going to take a deep toll on us because if what we are looking at turns out to be community-based transmission, means we really have to deploy a lot of rigor and hard work to trace all the contacts in all the local governments, and it's not going to be easy. Therefore, first of all, we want to take our destiny in our hands, where we expect that the federal government will do what they have to do. Taking our destiny in our hands means that we have opened our food bank once again, and we are beginning to gather materials to now go into distribution from one ward to another across Abia State. We are hopeful that very soon, because we are going to hold a teleconference among the governors tomorrow, and I'm also going to launch my campaign officially when that happens tomorrow. So in a few days from today, we'll be announcing to you what we intend to do, but we are hopeful that our 5 loaves and 2 pieces of fish will feed us. You see, we deployed the bottom-top approach. We started with the widows and the helpless, and we are coming up very soon. I think to get the point. It is easy to get the journalism because it's a community that is well known, and at the snap of a finger we can reach you. But just exercise a little patience. Let's deal with those that are really poor and helpless. Our hearts go out to those who need to be on the streets for them to feed, and they have families. Somebody is an organizer. He needs the Goverment to be on the road, and he needs the tide to go down for the Goverment to stop by and pay in cash. He has no bank account, and his children are there waiting. So for such people that cannot ride their train and cannot do their business, we are looking for our effort. I tell you this, it won't be long before we get to here. We can speak to the issues of finance. I think we've already said that our farmers are allowed to deal with their businesses. You don't need a crowd to go to farm, and we're doing everything to also provide what they need, the equipment, we are procuring fertilizers, and very soon we'll start making those available. For the taps, a tap will be a tap, but there's a way to cure it. The only way to cure it is that if you stay at home, no tap will come. But if a tap sees you carry your kayak around town, it will be difficult for any government to protect it. Because in the first place we had when we said, please stay at home. So the only cure for it is for everybody to lock down and stay at home. Let us watch for aggressive measures and see what's going to happen. And then it's unfortunate that we have 2 index cases, and that's exactly why I've been praying and crying that if we record a positive case in Abia, it will change our narrative, to change how we behave, to change how government looks at it, to change. We were getting to a point where we would have said, well, with compulsory face masks, we could all see what we can do while we lock down our borders. But that is not to be again, because we must keep everybody at home as we search out for those that have had one contact or the other with the 2 cases. I'm hoping that the results, that God will give us there with us, so that we don't have something that will escalate and blow up.
At Flow 94.9 FM, we've got conducive and well-secured environment for business. High-tech video studio, a state-of-the-art production studio. You can also listen live on www.flow949fm.com and watch our videos on YouTube at Flow FM TV. Flow 94.9 FM, not just radio, but a complete broadcasting house.